Hi, it's Dr. Robert Brueck coming to you again with another segment, What's New in Cosmetic Surgery. I've been away for the last several weekends and consequently haven't had a chance to do any new additions, but we're going to talk about a lot of new things today. And one of the things I want to talk about, I recently read an article about a new buttock lift. I get a lot of calls about buttock lifting, Brazilian butt lifts, implants, whatever. I read an article using the new modality Ultherapy. There was an article done by a Dr. Fabi, F-A-B-I, in San Diego, where he took several individuals, 24 of them I believe, and half of the patients received 2 treatments separated by 90 days. And what they found was that about 50% of the people showed some form of improvement. For my thinking, if I'm going to invest in a new modality, a new technology, I want to have a success rate that goes above the scales of 80, 85, 90%. So 50% to me is not really a good benchmark when it comes to trying to go ahead and improve the outcomes when people sometimes are spending thousands of dollars to achieve a certain expectation or a certain goal. I might also add that Dr. Fabi is also on the consult panel consultants for the manufacturers of Ultherapy. So I really think what it says is that as an individual, prospective patient, when you're embarking on possibly getting a new therapy, you have to do your homework because new therapies are coming on the line each and every week and month. And I think as a consumer you have to be extremely careful about what you do. Now, a new therapy that, when I say new, within the last couple of years, but one that we've been incorporating and using a lot, is Miradry. That's the microwave technology to decrease underarm sweating. As we've gained more experience with the Miradry technique and technology, we're now able to offer a one-time treatment to go ahead and rid yourself of underarm sweating forever. I would say 5–10% of the time people may need a second treatment. But before we would do 2 treatments, and as the results have evolved over doing hundreds of patients over the last couple of years, we've done in our practice probably 30, 40, 50 patients. And without exception, the vast majority, in excess of 90%, are very happy with the results. They no longer have to go and buy expensive underarm deodorants. They don't wreck their clothes. They don't have to pay for expensive Botox treatment. So now we're able to do it in one treatment, but at a higher energy level. And because of that higher energy level, we're able to achieve success rates that are probably in excess of 90%. So if you're one of those individuals, and there are a lot of them out there that are suffering from excessive underarm sweating, Miradry may be an answer to your problem. So really check it out. You can go to our website, Beauty by Brueck. You can type in Miradry, M-I-R-A-D-R-Y. Check out the corporate website. I think you'll be pleasantly surprised. It's a great technology. It really does work. And now you can get it in one treatment. One of the other things that I read an article recently was written by a Dr. Francisco in Madrid, Spain. And what he was talking about was the idea of doing peristernal, that is on both sides of the sternum, fat grafting to enhance the aesthetic result. I would say in the last year or two, I've started to offer my patients who come in for breast augmentation what I call a composite breast augmentation. What that means is they'll get an implant, hopefully silicone, and will also enhance that augmentation with their own body fat. So it's sort of like years ago when people used to have 45 RPM. We say this record's a TSW, two-sided winner. Both songs were hits and top 10, top 20, whatever. Well, when you do a composite aug, you get some suctioning done in an area such as your abdomen or your buttocks, your inner thighs, whatever. And we utilize that fat to enhance the cosmetic result of the breast augmentation. Now, most women, as they age, will go ahead and lose breast volume. Many times women that are thin, for example, have very little soft tissue to begin with. So by adding fat to the breast augmentation, we're able to go ahead and enhance the result. And what Dr. Francisco Brody did, what he did was he used the fat along the inner aspect of the breast. One of the problems that a lot of women want to address is, I've seen my girlfriend, she had an aug done, and she has a wide separation of her implants. Well, with the use of peristernal fat grafting, we're able to close that distance and give a patient more cleavage and certainly a much better cosmetic result. Another thing that I see with a lot of patients is they'll have a lot of loss of soft tissue along the superior aspect of the breast. And their breast is kind of tired, it's kind of sagging. We call that pseudotosis. So in many cases, I'll put in 50, 60, 70, 80, 100 cc's of fat on top of the implant to give more anterior fullness, more projection, more fullness superiorly where they're losing soft tissue. So we call that a composite breast augmentation. So we do an implant and then we utilize some of the patient's own soft tissue to enhance the cosmetic result. Another thing is the idea of anti-aging in facial skin. You know, that's probably one of the holy grails. There's several of them in plastic surgery. One is, how do I stop my skin from aging? How do I make it look better? How do I get rid of cellulite? How do I get an incision without a scar? Well, there's a Dr. Rigatti in Italy who's a well-known plastic surgeon who did some interesting studies. And what he did was he took some fat from the abdomen, put a stromal fraction of the patient's own tissue, took the fat from the abdomen, took that stromal fraction, when you spin it down, put them together and injected them into the facial skin of individuals. A second group of individuals had what we call expanded mesenchymal stem cells. Now what that means is when you suction abdominal fat and you separate out the different cell lines, some of them are stem cells. So what he did was he took the patient's stem cells from the abdominal fat and he cultured them, he expanded them. So then he injected those into the facial skin, and then what he did was he did biopsies of both areas, those that had the fat and the stromal vascular fraction, and the second group, which was just the expanded stem cells from the abdominal area. And what he found was that both improved the aging of the skin. That is, they saw a decrease in the elastin content. Elastin is what causes skin to lose its turgor. And so when you increase the elastin fibers in the skin, you go ahead and you lose rigidity, it sags more, it droops more, it hangs. They also found that when both segments were studied, both caused an increase in collagen, which is one of the things you want to do in order to improve the tonal quality of skin, make it look firmer, make it more youthful. So both seem to be doing quite well. And many times when I do facelifts, and I would say 30–40% of the time, I will go ahead and augment the patient's soft tissues with their own fat and stem cells from their abdomen, and sometimes we'll add what I call PRP, platelet-rich plasma, and I think that this enhances the take of the fat. So more research is being done along these lines. Another thing that I see in my practice has to do with doing cosmetic surgery on people that are on anticoagulants and blood thinners. And there was a study done, and what they did was they studied over 9,200 patients who had various cosmetic procedures, including facelifts, and they looked at those that were on anticoagulants and those that were not on anticoagulants, and they looked at the complication rate. And what they found was that people that were on anticoagulants such as aspirin, Coumadin, Plavix had a slightly increased risk of perioperative bleeding, that is, bleeding at the time of the procedure. But long term, they did not have any serious consequences such as skin loss or skin slough. There was a slight increase in infections, there was a slight increase in hematomas, but it was not statistically significant. My own personal feeling is that if somebody is on an anticoagulant, and their primary care doctor, their cardiologist, whatever, says that they're able to get off of the anticoagulants, then I stop the anticoagulants 2–3 days before the procedure, and then we go ahead and do the procedure. And then after we've gotten the sutures out, 3–4 days later, they can go back on their anticoagulant. So it was an interesting study, and it's an issue that we face all the time in cosmetic surgery, particularly for doing things like tummy tucks, liposuction, and the sort. Another thing that I found very interesting, I recently read some information about a new technology. We're going back to what we're talking about before, technology, what works, what doesn't. And this is called TEPR, T-E-P-R. And what it stands for is Transdermal Pigment Release. It is a non-invasive outpatient procedure that is done to remove tattoos. I was recently reading some statistics about millennials, people between the ages of like 18 and 35, and I think it was like 40-45% of them have some type of tattoo. And along with that tattoo, months later, years later, comes a certain amount of regret. Now, TEPR is an outpatient procedure that can be done to go ahead and eliminate the tattoos. It's a needle-type technology that will unroof the epidermis. The epidermis is the superficial layer of cells, and below that is where the pigment is layered. So this device will remove that epidermis. Then what you do is, on top of that exposed pigment tattoo, you place a proprietary cream or gel, and you let that soak in, and then it forms a scab. And 7, 8, 9, 10 days later, the scab separates and the tattoo pigment ink is gone. So I'm going to be going to Montreal to the aesthetic meeting. I'll be giving you a report on that when I get back. I'll be leaving in a couple of weeks. I'm going to look into this because I think it would be a nice technology if it's effective. In other words, if you get good results 80-90% of the time, I think it would be nice to offer that to individuals because we see a lot of people inquiring, what can I do for tattoos? And I've seen a lot of people that have had lasers spending thousands of dollars and really don't get the results or the expectations they want. So it certainly is something that we're going to look at and consider. Another thing, we were talking earlier about wrinkles. I mean, it would be nice if we had a magic cream or lotion or gel where we could go ahead and just take the cream, put it on our face, let it work overnight for a week or two, and have no wrinkles. There was a recent study done, and what they did was they took stem cells. Again, we've got a vast supply in our stomach, and then they go ahead and they took collagen from fibroblasts. Fibroblasts are cells in our body that create and produce collagen. And what they did was they took some rats and they irradiated the rats and they created wrinkles. Some of the rats had the fibroblast collagen producing cells injected into the wrinkles, and the other set of rats had stem cells injected into the wrinkles. And lo and behold, both showed a significant improvement in the appearance of the wrinkles. So that may be a new type of research that will be going on to come up with some clinically valuable products in the way of stem cells, creams or fibroblast creams or lotions or injections that might improve the situation with wrinkles. Again, these are some new technologies or some new procedures that are being done, and I want to say thank you for taking the time to listen. We'll be coming back to you again with some more information. And if you have a particular area that you would like me to address, you can email me at rjbrueck@abodyandface.com. Also, you can go to my website and email me, beautybybrueck.com, and I can do some research for you, maybe do a video blog on that. So have a wonderful weekend. We look forward to the next segment. Take care.